Okay, all right. So welcome everybody to, let me just click that thing, to the meeting of the Alternative 911 Response Committee of August 18th. Is that what date we are? I think we'd mostly like to hear from you, Chris. I know you sent us all the report for the first quarter, which was really it's a very informative graphic. So that was really good. But if you want to tell us any more about, things since then, and also I know you've been working with city staff on both a video and the flyer. So be great to hear from you about all those things.
Yeah. Councilmember Revelle and Cicely got us set up with Jesse from the city to help put together a video, kind of to get the word out, and especially around like what is 988, what we are, how are the two related, how are they different. So we were supposed to tape that today, but Jesse had something come up, so we're going to tape it next week. So we'll have that soon, hopefully, and that'll be a short video. We landed on doing it kind of like a mock interview format, so it wouldn't feel like really sort of fake and awkward. Like interviewing with a direct crisis counselor, sort of very, what happens when you call, like why might someone call, what is a staff member going to, talk to you about when they come out. So just the basic information that we thought people would want to know before being comfortable calling. I know we talked about like community engagement events and stuff. So just an update there. Moran Center had a share their table at the Connections block party. So that was great. Lots of engagement from people around 988 and us and stuff. And then we were at First Fridays as well for part of the time for the most recent one. I think that's been all of our Evanston stuff for the past month in terms of like engagement events. We're going to have a table. This is technically in Rogers Park, but I think serves but the Circles and Ciphers block party, which is coming up. Kristen, are you all going to be there as well?
Yeah, I won't personally, but Moran Center, I'll have a table there. We partner with Circles and Ciphers for our education advocacy program. That's our one program that goes over into Rogers Park. So you'll see some of our staff there too.
We figured there's probably bleed over as well with Evanston. So we'll be there. Still August 29th for a 24/7 transition. We made another night hire, so only 2 open positions now, which is great. I think that's kind of most of our general updates. Anything I'm missing? Anything anyone's wondering about, or anything from the report that you have like questions about?
Anybody have a question? You've been really busy. It's great. So how long do you think the video will be when it's finished? How many minutes?
I think the idea is to keep it pretty concise, because it sounds like it'll go up like on that local access channel, but also on like social media and stuff. So something that someone can watch through pretty quickly. So I think like 2 minutes was kind of floated as a guideline.
Great.
Will it be and you might have said this, but will it have a component to it kind of like when it's appropriate to call there versus 911 versus like just all the differences? Will that be talked about?
Exactly. Yeah. Okay. So us versus 988 versus 911. And the message there that we're giving is sort of like, if you're just looking to talk, 988 is probably best. If you're looking to meet with someone in person, call us. And then if there's a medical component or a life-threatening safety risk, then 911 still is your best shot.
Yeah, great. Yeah. So we're still finalizing the last sentence for the flyer, and it goes to how we're trying to get to see what the EPD is comfortable with our saying about when to call, when you call 911, what will EPD do? Anyway, the mayor is supposed to be talking with EPD to sort of clarify what that language will be. And then the flyer will, the flyer is really nice. It's got one side is the 988 information, and then the other side is all the trilogy information. And at the very bottom, it's this sort of, if you've got a medical emergency, you call 911, and so it'll trying to cram a lot of information into just a very not too crowded flyer. So I think the idea will be that we will try to print up a whole bunch of these, and I'm wondering if you all would think about how many copies of the flyer you might want to have for whatever kinds of events that you're might be having in the next 2 or 3 months, and we can see about getting some of those printed up. You don't have to tell me right this minute, but if you think about it and then give me a number, and then when the flyer is ready, we can print those, get some printed up. And
that we would be able to get electronically too.
Sure, for sure. Yeah, definitely. Yeah.
So I'd like to send that out just because we have like our client database, right? Emails and all of that. I think
Right.
that's how we're really going to get people to see a lot of it, is if we can send it electronically.
Right. Okay. So that would be more useful actually than trying to make copies of a flyer. But if you're tabling, wouldn't it be?
Yeah, at events and stuff, I think. But just in general,
Sure.
I think both would be helpful.
Okay.
Once we have electronic copy too, we can.
You can do that too.
Myself, we can print them.
Right. Okay. Okay. Yeah. Well, yeah. Let me know if you'd like the city to print some up for you, or otherwise we'll plan to just mostly count on you all to share it electronically and make copies as you need them. That would be good.
Mm-hmm.
Yeah.
One other possible like community engagement point that I wanted to see if it might apply to Evanston too. Something we're doing in Rogers Park and Uptown.
Could you say that again, Chris?
Sorry, I was getting echo.
Me too.
One thing we're doing with a few groups in like Rogers Park and Uptown is for business owners, for like groups of businesses offering a de-escalation training. So sort of like, this is the basics of de-escalation and mental health crisis, as well as then like how do you work best with the crisis team, sort of like trying to equip businesses to like know how best to work with us. So I don't know if that's something maybe that we would want to, offer at some point in Evanston as well. But.
Yeah, Angela, what do you think?
Yeah, I think that sounds amazing. The Chamber of Commerce could be, I could connect you to the director there if you don't know him already. And we could start there with maybe that being a funnel for getting that information out about the option for the trainings. I think that's something a lot of people would be interested in participating in, and also the various SSAs, the downtown Evanston, Central Street, Main Dempsey Mile. Each of those groups could send it to their members, while the chamber is sending it out if it's something that individuals opt in for, or if you want to do it as more of just like a one-time kind of, or an occasional offering, we could just disseminate the information of how to find the link and all that good stuff. Mm-hmm. But I would think that there would be interest in that for sure.
Mm-hmm. Would that be something to do virtually, or that would be an in-person training, Chris?
We've scheduled both ways, so we could do it either way. I think for this one, there is some utility to doing in person, and especially we planned it with like sort of role plays and stuff, but it absolutely can be done virtually if that makes it easier to schedule and easier to hold.
Mm-hmm.
Yeah,
so would the next step be for Angela, for example, to talk with the chamber and get something scheduled, or because you're ready to do those already?
Yeah, I mean, we would tailor it a bit for Evanston, but we're pretty much ready. So yeah, Angela, if you could send that introduction, then we could
Yeah.
talk and see if there's interest.
Mhm.
Yeah, let's email, you and I can email, and then I'll forward it around to other people that you would need to know.
Yeah,
Perfect.
Great.
that sounds great.
Yeah. Yeah, I think that's like, like this committee's been talking about these kinds of things, like it's just educating people is so important, because it's like the more that we can do at the front end to prevent problems, the better, right?
Right.
So it definitely seems very much in line with what we've been wanting to do all along. So that would be a great thing for us to layer in.
Yeah. Yeah. And with 3 different phone numbers that people can call, there's a real need to get the word out about what the difference is between them.
Mm-hmm. Yeah, and
Yeah.
on the flyer, I was just wanting to confirm, as we always do, that will there be a Spanish translated version of the flyer?
Good point. We have to do that too. Yeah, right. I'll mention that. Yeah.
Great, thanks.
And I think Jesse is talking about creating a web page on the city website with all this information as well. So we'll have to make sure that we have a Spanish version there as well. Yeah.
Great.
For the video, we do have a Spanish speaking staff is going to be part of that. So I thought we'd do kind of like back to back for each question.
Great. That's great. So Chris, in that email that you sent early this morning about a tangential issue, you mentioned that the CESA program is still being developed, or so what direction do you think it's going to be headed in, or can you tell yet?
I think it's hard to tell still. So like that piece that still is up in the air is how the 911 calls are going to integrate into all of this, as well as then like what the interplay will be between 911, 988 and the agencies. So right now, if someone calls 988, they're just transferring it to us when it needs mobile response, and then 911 is, informally referring to us, but that's not a set thing yet. So that's going to define for all the EMS systems and all the like communication centers, like how that looks and what the protocol is there.
Right. Yeah. And so can you talk to us a little bit about sort of how you Trilogy have been interacting with EPD? I know you said that you would be going to the station next week, a couple of days, to I guess meet the officers or talk to the dispatch folks, or what? Talk a little bit about your interaction so far.
Yeah, so we meet monthly with Officer Safier, who is kind of like a unofficial mental health champion. So he has introduced us to the different officers. We do the roll calls periodically just to talk to them about who we are and like try to build rapport, and give updates as stuff has changed. So that's what we're doing another round for. So roll call is where they assign, who's covering each area in the morning and the evening at the start of every shift. So we just give a little spiel on who we are and then have some time to talk to them. How the referrals come in from officers, they come a few different ways. So one is like, active situation in progress. So someone calls 911, they're out there, officer calls us because there's a mental health component, and either they want to refer someone to us for follow-up, they want us to come out immediately to support, so that's kind of like the active call in progress. We also get just follow-up referrals from them that then we'll follow up on. So sometimes they'll go out on a call and a situation will be immediately resolved from the like police safety perspective, but someone will clearly need help. So they'll, give us their information if they consent to it for us to follow up with them. One that's only happened once is when they are tasked with carrying out a court order for a hospitalization, for us to go along in a planned way to try to make that, go smoothly. So we've only done that once. There's not a high number of court orders that are done, so that's not super common. And then the last being sort of like people of interest, like mostly like really high utilizers, sort of like doing a consult and then like an integrated outreach together.
And so it's mostly officers who are already out in the community.
Yeah, and
then calling
that's
you.
actually a piece, like something we were going to bring up at the roll calls as like a piece of feedback we were going to suggest to possibly change, because right now they're calling when they get there, but then the officers are also very focused on response time, that that we are getting there quickly because they're very short and tight on time. And so like our suggestion was, if you call us when the call comes in, then we can like meet you out there. And I think their concern was that sometimes they don't find the person, as well as like they just wanted to make sure a situation was safe. But our message was like, it's fine if we get turned around, but that way we're both heading out at the same time. So it's not sort of like, doesn't go as long in that way.
So we aren't in the, I mean, I think in the ideal world, when we think about this program, we think about the call coming into 911 and the dispatcher feeling comfortable directly calling you rather than sending a police officer first. So we seem to not be at that point yet. Is that, has a dispatcher ever directly contacted you all, or?
Yes, but only in tandem with police. But that's the part that CESA needs to happen to like give the protocol for how that can happen safely. So
Okay.
That's what we're waiting for January for that last piece.
Oh, okay, right. Because we also had been thinking months and months ago of asking Cahoots in Oregon to do a training with our dispatchers. So that would still be a possibility. Or do you think waiting till January to see what CESA comes up with? How is that going to interact with us?
I think waiting, because that's going to be dictated to us and the EMS systems, how that will work, because they have like a dispatcher, they don't have a free flowing conversation with someone. It's like very clearly delineated by these like proprietary systems where they basically choose between multiple choice, like what someone's saying and then what the response is. And so what CESA is doing is like working with these vendors to alter these, like, I'm not using the right terms for the EMS stuff, but alter these like systems so that they can appropriately respond to this and like use mobile crisis as an option for a response.
Okay. So I'm going to look at my notes for a minute. Does anybody have any questions or comments about how the program's going, or?
Well, just that it sounds like, Chris, you're already on it with asking them to at least send you guys at the same time versus having it be a second step. So if we can't have it just be you guys, to at least have you meeting them there is closer to where we're wanting to be.
Yeah, I think like they, especially for certain calls, like there'll always be, a need to work together on that. And then you never know how people are going to respond. Like I was at I call it Connections on Friday, and the person, I couldn't say a word, but they responded very calmly and well to police. So you never know. So like when it does require police response, for us to be going at the same time is ideal, because then we can see how people are responding and then like tailor it from there. So.
I was wondering, Chris, when when the alternate team does get called in, even though the police is there, is it the police officer who make the decision to call the crisis response team, or do you get called at the same time, or what?
Right now, well, either could happen. I guess it depends where the call comes into. So if the call comes into our crisis line, police would only become involved if we felt it were necessary and we called them. If call comes into 911, then police would make the decision to call us. The way CESA is written, in theory, if someone calls 911 and a call isn't judged to be like a high safety risk, then the only way that police are to respond once CESA is fully implemented is if we request it. So the idea with CESA is that police won't respond in any mental health case without a safety component unless we directly ask for it. But we're not there yet.
And is it working the same in Chicago as it is in Evanston, as you know, in terms of interaction with the Chicago Police Department? Is that, are you having the same relationship?
It's different, just as, I mean, CPD is a very different institution. So like the CIT officers, we work, I would say, more closely with in Chicago, but that's a very small number of people, and the engagement from other officers is nothing. Whereas Evanston, we have like pretty good engagement from really the whole police force, but then not as much because they don't have a team that's really just dedicated to mental health. So it's kind of a balancing thing. And I think really just the size of each agency.
Yeah. Right. Okay. So Angela and Kristen and James, so Chris is going to be giving an update to City Council on September 12th. It's going to be a special order of business, so it's one of the very first items. Actually, it even comes before public comment, I think. Anyway, I'll make sure to remind you all roughly when it might start, so you could listen in if you'd like. And Chris I assume we'll try to show the video. Yeah, show the video and
that makes sense.
Yeah, and your graphic of the statistics, the data and everything. That'd be really good. Yeah, and then I'll make sure somebody from staff can talk about how we're doing with the living room. So, okay, so Angela's going to touch base with the chamber and also the like downtown Evanston as well, and the SSAs, or we'll let the, how do we?
Sure, yeah, I could connect Chris to the heads of all of those entities for disseminating info about the trainings.
Okay.
And then I can also distribute, flyers through multiple sources.
Exactly.
So yeah, as soon as that flyer is available, I'll definitely do the electronic distribution of a lot. And similar to what Kristen, I don't know if like the paper versions, I won't need as many of those, but I'll send you, basic info about who I would distribute to.
Yeah. Well, I think the flyer should be ready very soon, because the mayor's gonna try to finalize that last sentence so we can get that in production. So
that's great.
And so you've got the tabling event in Rogers Park, and are there other, I know we're getting to the end of the warm season, but
I think that might be everything that we have scheduled right now.
Yeah, right. Okay. So I guess the question is, when shall we try to put another meeting on the calendar? Just we're, I guess, probably going to go, we'll have the flyer finished, we'll have the video finished, we'll have, so we'll probably, well, it'd be interesting to hear about the trainings and how, what kind of, interest there is in that from our business community. And I suppose we should talk about once the video, talk about how we might want to encourage the members of the city council to have a program about this at one of their ward meetings. So that might be sort of a next step as well, because we'll have all the good stuff ready to go. So 3 weeks from today is right after Labor Day, is September 6th, or we could say 4 weeks from today, which would be the 13th, the day after the city council update. Should we, maybe the day after the city council update, so we can have see what kinds of comments and questions city council members had and those kinds of things. So once you mark your calendars for the 13th, and we'll get a Zoom invite out. Does anybody have any last questions or comments or thoughts? Just really appreciative, Chris, of all the information you keep providing us. And, it's been, when I think about our early conversations in this committee where we thought we were going to be trying to organize the program and make sure that the right people got hired. And I just think, oh my gosh, thank heavens for Trilogy. So
Yes.
we really, really appreciate the fact that you're there and you've gotten a whole team ready to go 24/7. And it's just really, really wonderful for Evanston. So really appreciate all that you're doing. So.
Thank you. Yeah, and thanks for all the help getting all the word out and everything.
Sure. Yeah. Okay, great. Well, if there's anything more that you'd like us to do, let us know, Chris, and we'll look forward to seeing you on September 12th. And in the meantime, then once we have the video and the flyer ready to go, we'll send those out electronically to everybody so you can share them with as many people as possible. So great. Okay. Well, thanks everybody. See you soon.